Hi everyone. Today we'll be learning about a new disease. Look at the picture. Can you identify the problem? You can see abscess formation. Can you guess how it is caused? See the causative organism. Have you ever seen this one? It looks like a fungus, but these are not fungus. Can you identify them? These are known as actinomyces or rye fungus. Actually, they are not fungus. And the disease caused by them is actinomycosis. It is characterized by formation of abscesses in the mouth, lung, and GI tract. This actinomyces is a gram-positive rod-shaped bacteria, facultatively anaerobic, and colonies form fungus-like branched hyphae. That's why the false name actinomyces, or otherwise known as rye fungus. These are opposite infection in human and animals. The genus is Actinomyces. The disease in cattle is known as lumpy jaw, and it is caused by Actinomyces bovis. It is a gram-positive rod-shaped anaerobe, pleomorphic, non-sporulating, non-motile branching forms. Remember, these are normal resident in the mucosa of the mouth and pharynx, and they reproduce asexually. They can form spore which will germinate and form hyphae. This disease occurs worldwide and it's prevalent in India too. Cattle are most susceptible, but other animals are also susceptible. This bacteria is, as I told, it's a normal resident in the GI tract. But when animal takes feeds containing thorns and all, there is chance of injury into the mouth, and it causes a deep wound or ulcer in the mouth, and this organism can invade the tissue. There will be an anaerobic condition which will facilitate the proliferation of this bacteria in the wound, and they will cause abscess and granuloma formation, invade the bone, this mandible. Centrally they will form the bacteria like this, and a club mineralized calcium phosphate can be produced around it. This bacteria will produce abscess in the mandible, and you can see how severe it is. You can see the mandible is highly enlarged, that's why it is known as lumpy jaw. And this is the normal mandible, and you can see how severely this mandible is being destroyed. See here, this mandible is completely destroyed. It can infect the human too. This in lumpy jaw, it produces suppurative osteomyelitis of the mandible, medulla to be infected, and cavity filled with granulation tissue containing nodules. Softening and liquefaction occur, and the pus gradually affect the cortex, rarefying it, and fistulae form. Periosteum is irritated to form new subperiosteal bone or involucrum and leaving cavities and fistulae. The whole bone is destroyed. You can see this. And the pathognomonic lesion is formation of sulfur granules. This is a human tissue. And histologically, you can see like this. This is the magnified form of the sulfur granules. They will be radiating filaments. And the sulfur granule consists of tangled mass of branching filaments of actinomyces. The center, the tangled mass of actinomyces, and a club-shaped reaction product surrounded by neutrophils area around this one. It can infect gut also. It is known as lumpy jaw in gut. It can infect this. It can also produce polyval or fistulous withers. Can infect human also. And how to diagnose it? Majorly it is by symptoms: enlargement of painful mandible, And from the pus, if you stain, you can identify these hyphae-like organisms. Remember, it is difficult to culture this bacteria. Histologically, you can find the reactions, club-shaped reactions. Okay, so this is the about actinomycosis. Thank you.